Welcome to LollieTasking with ADHD. I am your host, Dr. Lollity, a multi-passionate mom of three, a physician, and an ADHD life coach because, like most of you amazing women listening, I have ADHD. Join me as we chat about how ADHD affects our lives and learn strategies to help us all thrive, not just survive, with ADHD so we can live the life we want while accomplishing all our goals. Let's get started.
Hello, LollieTaskers. How have you been? Your girl has been on vacation. It's been an amazing week, just disconnected from life and technology. I and my kids went on a vacation where I had no phone service whatsoever. And you know what? It was amazing. It was needed. It was great. I will tell you, the first 2 days I was tearing my hair out. I was like, I need to contact somebody. I need to email this person. I need to call that person. And I think it was actually a great thing I did not have internet service. I am so excited. I did not have that opportunity to, go back to, how we tell ourselves we're on vacation and then we go back to doing things we shouldn't be doing, right? And we really do not totally disconnect. So I'm still glad I had that opportunity to disconnect. However, that being said, I have missed you guys, okay? And I know we had a 1 week break from podcasting. However, we're back. And today's podcast, I actually have an amazing child and adolescent psychiatrist, Dr. Tolu Alugo, and she was great. She came and talked to us about things we need to look out for our kids. And I thought this was a perfect follow up after last episode where I talked about emotions with our children with ADHD and why they should or should not be diagnosed with ODD. And if you have not listened to that, you could definitely listen to it after this episode. With that being said, here is our chats.
Hello, everybody. Welcome again to another episode of LollieTasking with ADHD. Again, you guys know me. I'm Dr. Lola, a physician and ADHD trained life coach for easily distracted women on a mission to maximize their 24 hours and, of course, fulfill their dreams. So I have with me an amazing guest today. I am so excited to have her. As you guys know, majority of women with ADHD, maybe I shouldn't say majority, but a good percentage of women with ADHD typically would have a child with ADHD. And it's not unlikely that most women get diagnosed with ADHD when their children are going through the diagnosis. So I thought, what better way to just talk more about it and see how we can help our kids. I have gotten the amazing Dr. Tolu. Dr. Tolu is a child and adolescent psychiatrist and an assistant professor of psychiatry. She is a founder of St. John Child and Adolescent Psychiatry Program, where she empowers youth mental health through education. She is married with 3 wonderful children, from 19 all the way to 10. So she's been through all stages of life, and I think she's such an amazing resource and would be perfect for this. So would you want us, you guys just clap your hands. I know you can hear me. Just clap your hands for the amazing Dr. Tolu Alugo. Welcome, Dr. Alugo.
Thank you very much. Thank you for having me. It's a delight to be here.
Oh, thank you for being here. We've been looking forward to be here, for you to be here. We also have been looking forward to be here. So we appreciate you being here. Like I said earlier, it's not unlikely that I coach women, professional women who have ADHD, and they're like, yeah, thank you for helping with my ADHD, but how can I help my child? And one of the big reasons why I started helping women is because I feel like if they know some of the things that I now know, right? If they know some of those techniques or the strategies, they can actually implement it in their children earlier. That way, they have a better way of dealing with some of the ADHD symptoms. So that's why I'm so excited to have you today. I know I said a little bit of your bio, but I love the audience to hear from you. Just to tell us a little bit about yourself, how you got into the mental health space, and how or what connections you have with ADHD?
Okay. Well, I'm a child and adolescent psychiatrist, which means I work with kids from about age 4, typically to the age of 19. Initially, I trained in psychiatry, which is just seeing adults from like 19 upwards, and then did a subspecialty placement or rotation for 6 months in child and adolescent psychiatry. And I just absolutely loved it. I love the fact that it's an opportunity to intervene early and change the trajectory of a child, of an individual's mental health. So that was how I found myself in child and adolescent psychiatry. And so one of the major disorders or major conditions I would see is ADHD. So like you said, a lot of parents would accompany their kids to assessments, and for the first time would say, I've had those symptoms all my life. So it's typical that they would then look for an assessment after their child has been diagnosed.
Absolutely. Absolutely. So if you were, let's say you're diagnosing a child with ADHD now, and then the mom comes to you and say, I think I have it too, or I know I have it. What are some things you usually tell them? Like, what are the first steps to do in one, helping your child understand the diagnosis? Because I've had some people ask me, should I tell them? Should I not tell them? I've heard some people say, I don't want to tell them, then it becomes a crush, right? And then they're blaming their ADHD for everything. But at the same time, should I tell them so it can empower them? Like what do you say about that? Well, how do you go about that?
Well, I mean, we know that education is one of the most powerful tools in treating ADHD symptoms. So, depending on the age of the child, first and foremost, the parent needs to really educate themselves on the condition. And as the child gets older, it will be important to have a very honest, age appropriate conversation as to why things are the way they are, why they may be having challenges at school, why they need extra support. And I think, understanding is key. And like everything else in life that kids will use as a crutch, this is just one of the many reasons that a child will find, my children would say, oh, I hit my head on whatever, so I can't go to school tomorrow. And you can say, no, that was the reason not to go to school. So you can still balance it out.
Absolutely. I totally agree with you. I'm all about education, education, education. And what did I do tell people? It's like, well, I feel like my child will use it as a crush. I'm like, the amazing thing about people with ADHD is there's so many successful people with it, right? So if they use it as an excuse, all you just got to do is talk about Simone Biles or, anybody else out there, and that tends to help it. Um, and with Another big challenge I hear a lot of time is how do I parent these children? They're usually strong-willed. They usually, or from the parent standpoint, right? It's like he just doesn't listen. He just doesn't do what he's supposed to do. He just, and a lot of parents, I won't say all parents, but a lot of parents tend to think the kids are quote unquote bad kids. Like, how do you parent kids with ADHD effectively?
Well, I mean, it's important to be empathetic and realize that there are challenges, there are differences that they're experiencing. You want to really focus on their strengths so that you're celebrating their strengths and trying to improve the areas where they are weak. And there are
Mm,
practical strategies that you can use. So, for example, one thing I always say to parents of young kids is if you're going to give your child an instruction, you want to come down to that child's height, make sure they're looking into your eyes,
mm,
and you have their full attention, and then give them an instruction that is not very long, not very long-winded,
absolutely.
then get them to say it back to you, make sure they get it, and then get them to go off and do it. And so just the practical strategies, but realizing that they are struggling, but don't focus on all that they're doing wrong all the time because everybody else is doing the same.
Absolutely. I totally feel you on that. Getting on their level, say it at their own, not just at their level, in addition to looking at them, but also the word level, right?
Of course, yes.
And then like the multiple steps doesn't work. Like, when you're like, oh, go to my room and get the broom. And when you get the broom and sweep the floor, when you sweep the floor, like that doesn't work with kids with ADHD, like just by my own experience. Like they'll get to the room, they may pick the broom, but then they may just start playing with the broom. And they never go through the multiple steps. So I always talk about, working on that one step approach to it. So like what about those kids that like, they're just like, oh, I forgot. Like, do you have any strategies to help them?
I think maybe in like using incentives. So for
Mm,
example, for those, okay, let's roll back a little bit. Maybe using lists, using reminders, so
yes.
visual reminders of what they need to, chores they need to do or steps they need to take. So you
Mhm,
have a list on your fridge or something just by the door, so they know before they head off to school, they need to have these items with them. And same coming back from school, these are the stuff that should be in their book bag coming home.
mhm,
So
mhm,
using visual reminders is one thing. The other one is if you think they're saying they forgot because they don't want to do it, maybe incentives of, well, if you do this thing, maybe you can get that privilege.
mhm,
Kind of tying the privilege to what you want them to do if it's kind of like a chore around the house. I had a parent tell me she would never ever wash the dishes or she would never put this stuff in the dishwasher. I'm like, well, maybe you need to tie time on her tablet to this loading the dishwasher, for example. So there's that ability to learn if you add an
yeah.
incentive to it.
Yeah, and I think it's interesting. So like a person she would never, and I'm so big on like your words, like I always talk about where my family's from, Yoruba, just like you. Like the word out of your mouth is so important. So if you say she would never, yeah, she would never, right? But knowing that first, believing in your child that they will.
Mhm.
And knowing that if they're not now, it's just because you haven't found the appropriate strategies for your child. And I always believe in trying multiple things. Like, don't just try one thing and stop and say, oh, it won't work. Or try one thing and like, oh, my child would never do that. You'll be very surprised that that same thing that they may not like in a certain situation, you take that in another situation and then they're like thriving with it and stuff. But I totally agree with incentivizing them and the whole positive feedback. I find that to work so well for my daughter. Like she just has that like what's it called, the positive euphoria, like whenever you just tell them, like that drives her. But then I have another child that you could say anything and it just doesn't drive. Then every child is different,
True.
you know. Like what would you say about those strong-willed children that they're just not listening? And unfortunately, some ADHD kids have been labeled OCD or oppositional disorder too. Like they've
Yeah.
been labeled so many things I really don't think goes with them. Like how do you help those kids?
I mean, well, we do know that, that ADHD commonly brings a friend with it, which is
Right.
oppositional defiant disorder. And that really responds to boundaries, consistency, and structure. So, for example, a child who is very strong-willed, it depends on what they're strong-willed about. If it's something
Mhm.
that's a deal breaker that's really causing trouble at school, for example, where their behavior is so difficult, and you want to reduce the negative behavior and increase the positive behavior, you have to find a way. And one of the ways is, like I said, rewards, consequences. As parents, sometimes we tend to take stuff away and use consequences, but
Mm,
the flip side may be to try and get them to earn a reward. And so
mm,
like using like a visual chart again to say, okay, if you do this thing, maybe you get 1 star. If you get 5 stars, you get this reward. And that
right.
may increase the positive behaviors that you want to see in them. So you have to just keep trying different strategies. Like you said, keep trying again and again till you find one that works, but be consistent because these kids they're very smart and like most other kids they will push you, they will push till you give up. Really, so it's really just you parents holding the line and being consistent so your child knows consistently what to expect for any behavior that they're showing, and that you won't give up.
Absolutely. And I agree with consistency and follow through, right? Like
Mhm.
I feel like sometimes a lot of parents, we have like so much like, if you do this, we will do this, and then we don't follow through on it. And then the kids are like, oh, she's not gonna do it. Either reward or punishment, right?
Sure.
You need
Yeah.
to follow through on it. Yeah, that is so amazing. Like with the little kids, and I'm a big believer in discipline and believer in freedom within boundaries. Like your children need boundaries. That way they can thrive appropriately. But what happens after those set children become teenagers and they become adults, right? Or young adults? I feel like that's usually where parents find it so much more challenging, and kind of when you go from that parent to mentor, right? And you have
Mhm.
like a 6, 17, 18, 19-year-old kid who has ADHD and you're trying to help them. Like any advice?
Well, I mean, like for the 16, 17-year-old, we know that their brain is still developing till they're 24. So
Mm-hmm.
you still can't
But they
assume
think they're grown.
they think they're
That's it.
grown.
They think they're
Exactly.
grown.
So that they still need that parenting support with some boundaries. So a 16-year-old can still have some boundaries. Of course, not the same boundaries of a 10-year-old or 12-year-old, but there are still some things that you need to put in place to say, okay, this is what time you need to be home, or if you're going to be driving, you can't be speeding. Otherwise, if you get a ticket, then maybe you lose the car. You still need to give
Mm-hmm.
them some guidance within
Mm-hmm.
reason. And then, of course, a lot of conversation. So you just can't lay down the law, explain, you need to explain why, because they're going to ask you why, but why? So be able to
Mm-hmm.
explain, if you do this, you might get into trouble, and then the police might come to the door or whatever. You need to give them, or if, I mean, a lot of the teenage girls are so impulsive, maybe they're flirtatious. Like, oh,
Mm.
baby, at this age, what's going to happen? Just kind of
Right.
explaining consequences that are beyond your control as a parent, that they will have to have lifetime, deal with for a lifetime. So conversation about things is important.
Yeah, with ADHD, there's a lot of impulsiveness that happens. Do you
Mm.
see that even worse as teenagers? Like you talking about the flirtatious aspect. Do you
Mm.
feel like a lot of the kids with ADHD have like higher likelihood of like, drug, alcohol abuse earlier, or are they more sexually aware more than the other kids, or is that just us thinking that?
Well, not that they're more sexually aware, but they're just more, because they're
They
impulsive.
carry it
they're
through.
not thinking of they're not thinking of the consequences of it. They're not thinking of what could happen. Where other
Mhm.
kids might think of the dangers, they won't. So
Yeah.
that is where you see the boys driving too quickly, trying
Mm,
substances, the girls going off on different websites, or going off with strangers,
interesting.
for example, because they haven't thought of the dangers of what they're doing.
Right. They just feel like doing it and they do it,
And they do it.
right?
They just follow follow whatever whim they have and go with the
And
flow.
I think that's something very important for us to discuss with our kids. Earlier I asked you, like, do you think like parents should tell their kids that they have it? Because I don't know why I always get that question,
Yeah.
but it's because of situations like this, right? Like you telling your children ahead of time, okay, you have ADHD. It's a reason, not an excuse. I say that all the time.
Mhm.
It's a reason, not an excuse. But the awareness is that you are like more likely to make decisions that you don't think through. So,
Mhm.
what are some accountability that we may need to put in place, right? So, if you want to go on a website, do you ask your mom first? Like, just, I mean, that may be too drastic depending on the age, but like putting things in place to almost like a checkmate or like a checking point to
Mhm.
prevent them from being too impulsive. There was one time a friend of mine was telling me how her dad put a speed limit on their car. That way they couldn't go more than like 60 miles an hour on their car. And it was a physical checkpoint, or yeah, checkpoint is the word, check.
Mhm.
A physical check to kind of prevent that impulsive nature that she and her brother may do if they had had or if they had friends over, you know how kids when they have friends and stuff. So he was like, nope, you would not go past 60 miles an hour in this class. So I think it is important that we as adults don't leave it on the kids to set those boundaries. Like sometimes we may have to set it for them.
I agree. I think that's important. And I think as they learn that, this is a condition that's lifelong, that has, implications for if they don't stay within particular boundaries. When they get into adulthood, when there's no parents managing them, they still learn to either find a friend or allow their partner or somebody, to just be their spotter when they're beginning to get a bit too impulsive. They understand that there's a risk that this could harm them, and they allow people to help them.
Oh yeah. Um, and then like even going, you talk about adulthood, I think is very important. I feel like that I kept saying that 60 to 90 because I'm like, that age is so tricky because they're almost adults. And even the one that's 18, they're adults by law, but I don't know if their brain is really adultified yet. Actually, it's not, right? But they feel like they're adults. And a lot of times, a lot of them are leaving their home to college. What are some things parents or what should parents do, right? Like how do you prepare your now teenage young adult for life when they have ADHD? Like, do you have any ideas or?
Well, I mean, the preparation for a child to leave home at 18 happens many, many years before they turn 18. So it's kind of like an ongoing conversation through the teen years and what kind of relationship we've developed with them, such that even when they do go off to university, you still have that connection. They can check in. You can
So you're
find out
saying
where
don't
they
start
are.
at 18, start at
No, that's
12,
too late. But at
13.
12,
That's too
13,
late.
so you
Got
have a
it.
real close relationship with your child. They're able to tell you what they're doing or where they're going. And then you can put a reminder out to say, well, you know what, if you're going to be drinking, who's going to drive you home? Just the same conversations you have with any other teenager who's going off to university, but just reminding them to check in, and maybe even allowing you to kind of have access, for example, to their bank accounts, or being able to, if they're in an Uber, check where they're being dropped off, stuff like that. But it all depends on relationship. If you're a child's friend, then that becomes easy. But if you're suddenly now wanting access to their lives at 18, then it's not going to happen.
And it's funny you mentioned the friend part because I'm like, you can be your child's friend and still be a parent. I feel like when people hear friend, they feel like they have to like ignore all consequence, be their best buddies. And that's not the case. Being someone's friend, actually, if you're a good friend, you want to hold them accountable, right? Like I want my friends to be able to call me out. I want them to be able to say, no, you messed up and here are the consequences. Because after all, you are the parents, right? So
yeah, that's true. I mean, you have to balance it. You have to, as you get older, you stop being kind of like the parent who's laying down the law, but you still have to kind of hold them accountable, like you said. So there's a balance between just being a friend, but you still have to be a parent to some extent. But when they're 18, 19, it's kind of your parenting role is diminishing.
It's more mentorship.
Yes,
More mentorship role. And you ease into it gradually and truly. I really do think that most kids, if they have not already, or like if they're like newly diagnosed, especially going into college, there's a lot of like difference in their executive function as they enter college versus when they're home. When they are home by this time, they do their homework by this time. But in college, that structure is gone most of the time, and they have to recreate it. I have some friends that are ADHD coaches just for college students. And I think having either a coach, especially if they have severe ADHD, having a coach helping them with that transition may be a good thing, because that's where I see a lot of kids, especially that first semester in college, a lot of them just fail because they're like, what is going on? I used to be a very good student and now I don't remember, how to study anymore. But yeah, I'm looking forward to my kiddos growing up, but it's still kind of scary. um All right. So and for those of you guys listening, for people in Accomplish with Ease program, this is a live podcast that we record, and they have access to ask questions during the recording. And we have one of our amazing folks, Meg, who's asking a question. She said, how do you guide your 19-year-old ADHD to listen or acknowledge a sibling's opinion when she's very passionate and defending her opinion or beliefs? How would you do that?
I guess it comes back to what have you always done? I mean, how this opinionated teenager didn't just become like that at 19. She's always been like that. So I mean, it's how you've handled it before now, which is, talking about it. When she's calmer and less passionate, is to say, that conversation you had with your sibling, could it have gone a different way? Can you look at the other side of the coin? Maybe she's just looking out for you, kind of having an open conversation when things are less heated. It would be my own advice to handling that.
Yeah, and I think also, like, especially we multi-passionate people, right? I'm super passionate, and I believe in what I believe in. Okay. And, and sometimes it may come off negative, right? Because she's defending her opinion, and her opinion is the right opinion in her eyes. And she's not wanting to listen to her sibling's opinion. So sometimes it's good to show them how they're acting and just be like, what if your sibling did this and this and this and this? Because a lot of times they're not even realizing like how it's coming across, because everything is perception at the end of the day. She just feels like she's defending her opinion, but if the perception comes off like you're being a jerk, man, like it's okay to like call them out on it, but in a nice way, because we also know ADHD, we have like really bad emotional dysregulation issue, and we're super hypersensitive. So it has to be done, yes, I agree, by talking in a very objective way. That way they don't feel attacked, because then it goes into another temper tantrum and crying and all of that. Which actually brings me to you, Dr. Tolu, because you have a emotional course that you do as well. Can you tell us a little bit about that?
So it's called the Emotions Ambassador Program. It's really to raise emotional awareness in kids. So there's a junior program for ages 9 to 12, and a senior program for 13 to 17-year-olds. Okay. And we just go through, learn about healthy emotions, ingredients of healthy emotions, how the brain produces emotions, why we feel sad, why we feel anxious. We discuss relationships and emotions, so bullying, abuse, stuff like that, and how to talk to your trusted adults, how to identify an adult in your life that you can talk to. Because we realize that most parents don't have the vocabulary to discuss emotional things with their kids. It's like an awkward conversation. And we're just hoping that this would improve that ability to have a conversation with your 9 to 12-year-old about, their emotions and how they're feeling.
So is this a program for the parents and the kids too, or just the kids?
Ideally, it's it's like an 8-lesson program. So it's ideally the parents should do it with the kid, at least be close by, because there's some quizzes, and then there are discussion guides, and there's assignments to do every week. So that way parents should at least be able to check that out, have a discussion with them. So that way they're really involved and they can be sure that their kid is getting something out of it.
Right. And is this for like people with ADHD, or
it's everybody? No,
everybody.
Every child.
Okay. No, because we have a lot of emotional hypersensitivity, especially with ADHD, which we're learning a lot more of. I think almost everybody I know who has ADHD has at least that aspect of it. So I think it'll be something very good also for kids with ADHD, just to be able to acknowledge their emotions as well. So that's awesome. Do you want to tell us how people can get in touch with you, or if they have any questions, how they can reach you?
So I have a website, is www.stjohncap, that's cap with a double P.com. Also, I'm on Instagram at St. John Cap. I have a YouTube channel, St. John Cap. So if you send me a message on Instagram or through my Facebook, through my website, you can contact me via that, and I'll definitely reach out to you again.
And what about the emotional course? Is that on your website as well?
It's going to be launching in a few weeks, so the link
nice.
will be available on my website in a few weeks.
Okay. When exactly? Do we have a date yet in case people wanted it?
So I'll say by end of May.
End of May. Okay, perfect. All right, we'll look out for it. We'll put all that in the show note, especially if you have any kind of emotional, if you have any kids. I just want to learn about emotion. I think it's very important that kids be aware of their emotion, because when they really have that vocabulary to deal with it, there's less temper tantrums. Gosh, I'm so tired today. Temper tantrums, and they can better communicate what's going on with you. Because I feel like a lot of kids these days, they either shut down because they feel like nobody understands them, or they go the other way where they're just trying to cause attention seeking behavior. So I think that would be a very, very good program if you have young kids to be a part of. So I think we had an amazing conversation today. Was there anything else you wanted to talk about before we round up?
Just to say that moms with ADHD are great moms, and you're really, specially placed in your kids' life. If your child has ADHD, you already have gone through it. You can help them, and people with ADHD are very creative people, so you can help your child nurture their strengths and minimize the weaknesses and understand what they're going through. So yeah, really specially placed in their lives. I think it's important to note that.
Absolutely. And I say that too. I think it's very, very important we focus on our positives and try to bring that out of our kids too, when we're trying to talk to them, when we're trying to explain things to them, and even when we're trying to help them through whatever issues, ADHD or not, that they have. So it's been amazing talking to you. Thank you so much for coming to LollieTasking.
Thank you for having me. It's been great being here.
Oh, of course. We'd love to have you back. So I would say, if you could, people listening today, if you could do one thing from this episode, just pick one thing, write it down, create a plan, and work on it. Okay. Don't just listen to work on it. Again, it's been very amazing for you guys listening in. I appreciate you guys listening. If you want to share this with your friends, please do. And I would love for you to please leave a review. Maybe I may shout you out on the next episode of LollieTasking. But till next time, remember, you can do it too, with some planning, a little bit of balance, and a dash of determination. Thanks for hanging out with us on another episode of LollieTasking with ADHD. If you like what you've heard today, I would love for you to click the subscribe button, rate, and leave a great review, in addition to sharing with your friends. Your review allows visibility and also allows other amazing women to find this podcast. Also, if you have any questions or topics you would like for us to discuss, please contact me via direct message on Instagram at LollieTasker, or email us at hello@lollytasking.com. Till next time, this is LollieTasking with ADHD.